very beautiful morning to you once again. Thank you so much for tuning in and joining us right here on Women Radio WFM 91.7. This is Nigeria's first radio station for women and their families. I hope you're doing well. I hope you're feeling great today. I hope you're healthy today. All right, so you're welcome to Radio Doctor right here on Women Radio WFM 91.7. My name is Rose Yusuf Kaiser, and of course, I welcome you to the program Radio Doctor that comes to you Mondays through Fridays at 10 a.m. All right, so on Radio Doctor, of course, you know that this is your free health consultation health program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advice on radio, right here on Women Radio WFM 91.7. So Radio Doctor comes to you Mondays through Fridays from 10 a.m. All right, that's what we do right here on Women Radio. At 10 every day of the week. All right, so today on Radio Doctor is on women's health. You know, every day of the week on Radio Doctor, it's a day for a different specialty when it comes to health. So yesterday, Monday, was children's health, and for today, it's women's health. All right, so on Radio Doctor, women's health on Radio Doctor is sponsored, rather is supported by ACT Foundation. All right, so that's what we are looking at today. Okay, it's supported by ACT Foundation. Let's get to, of course, go ahead and meet our doctor for today. Now, my name is Joseph Kaiso, like I said, and our doctor for today is Dr. Ede Edokpolo Osazua, and he's a consultant obstetrician and gynecologist at St. Ives Family Hospital. Good morning, Dr. Osazua. How are you today?
I'm fine. Good morning, Rose. How are you today? I'm fine.
I'm okay. How have you been? How have, the past week with your patient been?
Yeah, the patients have been fine. It's just the cost of living that's driving us a bit crazy. But so far, so good. When there is life, there is hope.
There's hope.
So we are hopeful that we'll get better.
Yes. Yes, hopefully to get better, we'll have better days ahead. So, well, cost of living, we'll keep surviving. We'll get there. We'll get by. All right, so yes, Dr. Sazua today is consulting and advising on gonorrhea testing, treatment, and care. So if you have been following our conversations, you know with Dr. Sazua, we have been talking about STIs, for the past weeks with Dr. Sazua. We're talking about STIs, their treatment, and all of that. So today we are concentrating on a particular STI, which is gonorrhea testing, treatment, and care. That's what we are looking at today. So the number to call is 070-917-917. Send us a text or a WhatsApp message to 070-317-56537. All right, Women's Health on Radio Doctor is supported by ACT Foundation. So to join the discussion, you can send in your contributions to our social media platforms, Facebook, Instagram, Twitter, and YouTube at WFM917, or you can log on to our website, www.wfm917.com. You can also download our mobile app, WFM917. You can get to listen to us from any parts of the world through any of these platforms. We are always there with you. So yet, let's go ahead today. On women's health, Dr. Sazua is here, and we are looking at gonorrhea testing, treatment, and the care. All right, so let's start off, Dr. Sazua. Now, what are the common methods? First of all, let's even know what gonorrhea is. Let's start from that. Now, we know that is an STI, but further let us know what gonorrhea is, how it comes about, all of this, an overview of gonorrhea.
Thank you very much for having me once again in this period where we are actually dealing with sexually transmitted disease. And I said that we'll be taking them one after the other. And the beauty of today that we'll be talking about one of the sexually transmitted infection. The one we'll be dealing with is gonorrhea. Okay, so people are aware of gonorrhea, aware of syphilis. There are different types. But gonorrhea is very, very key. You must know that has become an issue and become a burden in our society. Bear in mind that there are long-time complications that can arise from it. Let me start by saying gonorrhea basically is a form of sexually transmitted disease, infection It's preventable and definitely curable. Okay, that is caused by one organism which is called Neisseria gonorrhea. If I was talking to medical practitioner, I would not say gram-negative intracellular diplococca. That is the name of that is how the organism look like. It's like a coca. So it's a bacteria that is caused by an organism called Neisseria gonorrhea, which can be transmitted through vagina, through oral sex, through vagina, through oral sex, through anal sex, and basically, it can be prevented by having what we call regular protection by the use of condom. Now, having that in mind, that it has become an issue, gonorrhea infections have become an issue and become a burden in our society. Based on the long-time complication that may arise from it, as well as the rapid rise of gonorrhea, especially in low socioeconomic environment like us. In 2020, there were an estimated 82.4 million new infections among adults globally. Most women with gonorrhea, actually, that makes it a bit funny. They don't have any form of symptoms. They are usually asymptomatic. And when you don't treat this gonorrhea, there's a tendency that there will be a long-time complication, which I mentioned earlier.
Yeah.
And there's a rising incidence of antimicrobial resistance to gonorrhea. So it has become an issue in our environment, and we have found that, the scope of the problem, which I think we should know, which is very important, is that gonorrhea basically affects adults between the age of 15 and 49 years old, and are usually more higher and more vulnerable population. So, and we find that this gonorrhea basically is usually in the semen and in the saliva, and this can easily be transmitted during the course of sexual intercourse.
You said saliva too?
Yes.
Okay.
So, can usually be transferred during sexual intercourse, especially during either anal penetration or during normal sexual intercourse, both anal and oral intercourse. So, and it has become a major problem in our environment, as I said, because of the long-time complications that's associated with gonorrhea. The major challenge we also have with gonorrhea, most of the time they are asymptomatic, and when they do present with symptoms, there are usually a long-time complication. So I will rest my anchor there. I will rest so that you can ask your question.
Okay.
And as I said, that in 2020, the World Health Organization estimated that 82.4 million new infections came up, and these were commoner among women of the reproductive age group between the age of 15 and 49.
Okay. All right. Thank you so much, Dr. Osazua, for that. This is Women Radio WFM 91.7, and this is the program Radio Doctor. So do all to call in, send in your text or WhatsApp message. Let's get to hear from you this morning on gonorrhea. That's what we are looking at this morning. Now, we've been saying we'll look at the STIs, sexually transmitted infections, one after the other. And today we are starting up with gonorrhea. This is Women's Health on Radio Doctor, right here on Women Radio WFM 91.7. The number to call is 07000 917 917. Send us a text or a WhatsApp message to 070 317 56537. Those are the numbers to call us with this morning. All right, so Dr. Osazua has told us what gonorrhea is and how it is transmitted. Now, Dr. Osazua, when you talk about gonorrhea, one of the first things that comes to mind is, it's a man thing, is a man thing. So now, how common is this in women?
Okay, it's very common in women. There was a recent study that was done that shows that when they were comparing sex with looking at the sex demographic, they found out that it was more in females than in men, ratio 4:1, or more in females, when they were comparing the racial predisposition to gonorrhea. So it was more in females than in men.
Wow.
It doesn't really have any race, racial, and independent. But however, they was also found out that when they now compare and match it with age, they found out that it was also common in women in adolescents between the age of more common in adolescents and between the age of 18 and 24. So they were more common around that age. So they found it more around that age, among those age group.
Yeah.
And also found out that it was more common in female than in male.
Okay. All right. Thank you so much, Dr. Suzua, for that. Now, let's look at the common methods used to test for gonorrhea in women.
Okay. Well done. Before we look at the common methods, let me just quickly run through the symptoms the patient with gonorrhea will present. As I say, basically, most of the time, they don't have symptoms.
Yes, you said
and it's not actually the vaginal discharge as the primary symptom, based on where the infections, based on the organ that is affected. That is how the patient normally presents. For instance, the thing can affect the eyes, it can affect the rectum, which is the anus, can affect the vagina. It can even go as far as affecting the throat. Any area that has what we call columnar epithelium, or what we call columnar and cuboidal epithelium. Those are the areas that normally affect, and these are present in the vagina. So, when they do affect the vagina, patient will tend to have vaginal discharge. Sometimes they do have what we call pain when they are urinating. When they have pain when they are urinating, the kind of discharge usually yellowish, can go as far as greenish, and it can also be cream, like a cream in nature. Sometimes to have pain or burning sensation during urination. Some people can also be bleeding in between the period, especially those people that have what we call ascending infections that now affect the cervix. So they can bleed during sexual intercourse, what we call postcoital bleeding. So they can also have what we call intermenstrual bleeding. That means in between periods, they will be seeing their period, they will be bleeding. So sometimes it's actually there's something they have what we call gonorrhea. And some of them too can also have pain during sexual intercourse or dyspareunia. And some patients can also say, oh, they have low abdominal pain, especially when there's a pelvic, when there is a pelvic inflammatory disease. So when it now affects the rectum too, sometimes some people have complaint in the rectum, don't talk that there's nothing there. Some of them can have discharge from the rectum, especially for those who practice anal sex. They can have discharge from the rectum. Some of them can also have what we call bleeding from the some people can be bleeding from the rectum. They will not send them to go and do a protosigmoidoscopy. I said, not anyone realize that, oh, maybe these people have gonorrhea. Some of them can also have what we call soreness, and they can have pain when they are passing during bowel movement. So when they are trying to go to the toilet, they feel some kind of pain, and some of them can also bleed from the rectum. So that is when they affect the rectum. Sometimes it can also affect the throat, because those that does oral sex, so they don't have what we call sore throat, and they can have pain, they can have, maybe it just come out sore throat or common cold. Whereas some these patients actually have gonorrhea, and they can present with sore throat. So when you have a patient that are treating for sore throat and it's not getting better, it's usually wiser to investigate for gonorrhea. Therefore, mothers who are pregnant with babies who had gonorrhea, these babies will definitely not grow well. Okay, they suffer from what we call intrauterine growth restriction, and so sometimes the gonorrhea can affect their eyes, and the baby can have what we call ophthalmic neonatal, i.e., that means that there is an infection of gonorrhea that has affected their eyes. And these patients, if they are not well treated, the baby can end up having blindness. So sometimes in the rural environment, blindness can occur not because there was anything, because probably the mother has diarrhea, has gonorrhea that was not attended to. The baby came out just a common red eye, whereas it was an infection with gonorrhea during the birth through the birth canal, and the baby can suffer from damage to the eyes, and they can have what we call keratoconjunctivitis. And if this is not well managed, the cornea is damaged, and they can end up being blind. So it's a multisystemic disease, so it can affect virtually all organ, any area of the body. And if it progresses so much, sometimes some of these patients will end up having, especially when you don't treat them, they can have a pelvic inflammatory disease. They can have ectopic pregnancy, which we have discussed on these stations. Some of them may also end up not becoming pregnant because the epithelium have been damaged. And for men too, so when we examine them, we now discover that, some of them have what we call scrotal swelling. Their scrotum are usually big and swollen. Some of them also have what we call urethral stricture. Sometimes, because it has affects the urethra, the pathway which the urine passed through. I know when I was in UCF, we had a patient that has urethral stricture, and probably was a result of gonorrhea. So because if it's not well treated, the thing will damage the urethra, and the patient can no longer pass urine. Then what you now need is big, and look for another way where the person can get better. So in men too, there's some men can have swelling of the testes, they cannot pass urine, and because of urethra, the urethra is blocked. Some they can end up becoming unable to get anybody pregnant because the testes, as well as the seminiferous tubes and the vas deferens, the organs are badly infected by gonorrhea, and they may end up not producing sperm again and begin to ask us what has happened. Maybe they did not pay attention when things were happening. So basically, those are how the patient presents with. Sometimes it can become so serious that the thing can even spread to other parts of the body. This is what we call disseminated gonorrhea infection. That can occur and manifest as fever infection, and it can affect the liver, and we now call what called the Fish-Hall syndrome. It can affect other parts of the body sometimes. It can affect the intestine, and you may have some issues. So those are basically how patients with gonorrhea do present. So when we notice those kind of presentations, before I answer your question, we try to, when they present, we discharge. What we normally do is that we make sure that, this is now our test. We take swab. We take what we call swab from different parts of the tongue. We can take from the rectum, we can take from the cervix. Sometimes we can also do throat swab. When we now do that, then if it's a child, we can take swab from the hand and send for culture. The culture will now tell us that, there is an organism, they will now treat. Funny enough, it's very easy to treat. An antibiotic that you take end up, if you take antibiotics, it ends up being treated without any form of stress. So the antibiotics that we use to treat them, and the patient tend to do well. But let me say this, that when there is a complication that has been done by, there is a complication arising or resulting from infection with gonorrhea, then this complication cannot be reversed. I will say it again, this complication cannot be reversed. That's why we need to be very careful.
So what kind of complications are we even talking about here?
Yes, complications are vast, there are many. Now, most of the time, if the cervix is damaged, and the womb is damaged, and the fallopian tube is damaged, and the ovary is damaged, automatically the patient will end up having what we call chronic pelvic pain. Okay? The pain will be there. There's nothing anybody can do concerning that. Most than you give them analgesia. Two, sometimes, because if the woman has, if all those things are damaged, there's a tendency that this patient cannot conceive again. So most of the time, you cannot reverse them. For a man that has the damaged scrotum, it cannot be reversed. Or a man that cannot pass urine as a result of urethral stricture, it cannot be reversed too. For a baby that has blindness, for instance, from the complication, it cannot be reversed. So most of the time, that's why we tell, be careful in how you live your life. So most of the complications are not reversible. I will say that again. Most of the complications from gonorrhea are not reversible.
Wow. All right. Thank you so much, Dr. Sozua. This is 27 minutes after 10 right here on Women Radio WFM 91.7. The number to call is 07000 917 917. Send us a text or a WhatsApp message to 070 317 56537. Those are the numbers to get in touch with us this morning on the program Radio Doctor. Now, Radio Doctor is your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise right here on Women Radio. And then it comes to you from 10 a.m. Mondays through Fridays. Now, Women's Health on Radio Doctor, which is today, is supported by ACT Foundation. And we have Dr. Ede Odokpolo Osazua, a consultant obstetrician and gynecologist at St. Ives Family Hospital, and he's consulting and advising on gonorrhea testing, treatment, and care. That's what we are looking at today. So feel free to call in, send in a text or a WhatsApp message to 070 317-565-37. You can call in to ask your questions on 070 07000 917. All right, so Dr. Osazuwa has told us what gonorrhea is. He has told us the common method used to test for gonorrhea. He has told us the symptoms of gonorrhea. He has told us the potential complications that comes with untreated gonorrhea. And he has said that gonorrhea is actually treatable. All right, it's actually treatable. And it's something that when presented on time could actually be very, very treatable. All right, so Dr. Sozua, why gonorrhea is treatable in women? Now, how long does it take to actually cure gonorrhea? And if that is done, is it a once in, if once you treat it once, that's it, or you have to treat it over and over again? Before then, let's pick this call. Hello, good morning. Hello, good morning. Hello, good morning. All right, we couldn't hear this caller. Do want to call us back on 07000 917 917. If you can't get us through the phone lines, please feel free to send a text or a WhatsApp message to 070 317 56537. We are definitely here to take your calls this morning. All right, so let's get to hear from you, your thoughts, your concerns, and your questions on gonorrhea. Testing and treatment, especially in women. Let's get to have all of that because we are here for you. 07000 917 917 is the number to call. Send us a text or a WhatsApp message to 070 317 56537. All right, Dr. Sozua, so I was asking, it's gonorrhea a once and for all kind of treatment, or after treating it there's a possibility that you might also come down with gonorrhea all over again? Hello, good morning. All right, couldn't hear this caller too. So Dr. Zozo, over to you.
Yeah, thank you very much for that wonderful question. It's a one-stop treatment. So you treat, sometimes most of these drugs are start dose, that will normally give to this patient to treat gonorrhea. So usually a one-stop treatment, you treat the patient and you now counsel the patient on method of prevention. So after treatment, the patient can resume sexual activity within 1 week of treatment. So you give them basically antibiotics, they are all in the market. I want to make sure.
Dr. Zazua, just hold on a bit. Dr. Zazua, please just hold on a bit. Let's pick this call. Hello, good morning.
Yes.
Hello, good morning.
Good morning. What's your name? Where are you calling from?
Yes, this is Tochi calling from Mowe.
Tochi from Mowe. All right,
Yes.
Tochi. You're welcome to Radio Doctor. So, do you have a question for us this morning?
Yes, I want to ask what are the causes of diarrhea?
Diarrhea or gonorrhea?
Sorry, gonorrhea. What are the causes of gonorrhea?
All right, Tochi, thank you very much for calling all the way from Mowe. Thank you so much for calling. All right, so I'm sure that Dr. Suzwa has already told us, what brings about gonorrhea. It is a sexually transmitted infection. All right, so Dr. Suzwa, in the course of, further explanations, I'm sure we'll definitely get to touch this once again. So go ahead, Dr. Suzwa, or if you would want to touch on Tochi's question, no problem.
I'll come back to the question. What are these? We are still have some time. So
Yes.
What are how can we get?
Yes, he's asking for, how we can get that.
Oh, okay. Okay, fine. So at this point, fantastic, good question. So as I said earlier, it's mainly through sexual intercourse, any form of sexual intercourse, i.e. during what? Oral sex, vaginal penetration, or even people that does anal sex. That is how you get gonorrhea, because most of this organism stays in the semen and at the same time stays in the saliva, so they can get it. But so that is how you can acquire gonorrhea. Let me quickly clear the mind. Okay, before I go to the mind, let me say that if the risk of a female transferring gonorrhea to a male is usually about 20%. It's very sexual intercourse. It's about 20%. in first sexual debut. So, for instance, if a woman has gonorrhea and a man doesn't have gonorrhea, first sexual intercourse is about 20%, but when they now have repeated sexual intercourse, let me like 1, 2, 3, but the percentage increase to 60 to 80%. But the other way around, the risk of a male of transmitting gonorrhea to a female in first sexual intercourse is about, female are always at disadvantage, about 50 to 70%. Just one sexual intercourse. So the risk of the woman acquired gonorrhea is higher than male. Okay, so it's usually very high. So that's why we tell people, be careful. For a woman to transmit gonorrhea to a male is about 20%, but for a male to transmit gonorrhea to a female is about 50 to 70%. Then, having noted that, so there are some myths that surround gonorrhea too. People believe that gonorrhea can be treated by herbal medicine and co. That is not true.
Yeah.
Because those days when I was small, there are a lot of people that advertise those things on the road that you can take this one, you cure gonorrhea and everything. And there are STI centers all over Lagos who are making money. That is not true. But the good thing is that the antibiotics that treat are readily available. So don't that you go and take one herbal concussion somewhere and you say you are treated gonorrhea, you end up having complications later in life. That at the end of the day, when you're not coming, when you're maybe probably you're not married, you're not coming back to meet us, you're no longer producing sperm, you'll not be asking me, what are the things that caused it? That becomes an issue. So let me also say that underly kissing and hugging cannot transmit gonorrhea to other. Yes, cannot. Sharing of drugs, sharing of drugs and sharing of drugs too. Actually, does also transmit gonorrhea. Using a toilet, some people say I have toilet infection. Using a toilet after someone else has used it doesn't cause gonorrhea. So we should know that one clearly. Using toilets after someone has used it doesn't transfer gonorrhea. Sharing of drugs and souvenirs doesn't also transmit gonorrhea. Hugging and holding hands doesn't transfer gonorrhea. Because the reason behind this is that this gonorrhea actually cannot stay outside for a very long time. So there's a tendency that when the gonorrhea comes across a place that there's no air, that's why we say it's an intracellular. You need an organism to survive. So it doesn't survive outside at all. So that is why hugging, and sometimes people say kissing is a bit controversial because even deep kissing now, because the gonorrhea can stay there, can cause deep kissing can transmit gonorrhea. But hugging, holding, cuddling, sharing of foods and souvenirs and wares and clothes, using a toilet after someone has used it doesn't transmit gonorrhea. Okay, so we should know that one. Someone call for sneeze doesn't transfer gonorrhea. We should be very clear. Someone sneeze, droplets, and this doesn't transmit gonorrhea. So we should know that in our mind. Sometimes we can infect auto inoculation in where that but during fingering, let me know that one. Fingering, what is it called? Fingering can spread gonorrhea. Sometimes some people have gonorrhea in the genitals, and they can transfer it back and can put it anywhere in their body, maybe put it in the mouth and everything. So that's what we call auto inoculation. So I want to make this point very clear.
Okay.
We'll go to prevention.
All right. Thank you so much, Dr. Sazua, for all of these explanations and going very, very deep into all of them. All right, 070917917 is a number to call. Let's get to have your thoughts, your questions, your concerns on gonorrhea, testing and treatments. Okay, let's get to have all of it this morning. I'm here. Dr. Sazua is also here to attend to your concerns and to answer your questions this morning. The number to call is 070917917. Send a text or a WhatsApp message to 07031756537. Hello, good morning. Hello, good morning. Can you hear me? All All right, so do well to send in a text or a WhatsApp message if you can hear us this morning, or maybe I'm the one not actually hearing you. Well, whichever way it goes, just do well to send in your messages, your text or your WhatsApp message. We're definitely here to take all of them. All right, and of course, Dr. Sozua is here and would attend to your questions, your concerns, and all anything at all that comes to mind on gonorrhea and its treatment, testing, and all of that. Hello, good morning. Can you hear me? Okay. Do you want to call us back? Send us a text or a WhatsApp message. All right, so Dr. Sozua, let's get back to our gonorrhea discussion, because you have actually told us a lot, and I feel like there's still a lot more to learn when it comes to this, because we were just looking at it like something that you can just take herbs for, but you've just made it very clear that herbs cannot work for this. So are there other remedies, like maybe something you can do from home to actually cure gonorrhea, especially for women, or it just has to do with the antibiotics? Hello, good morning. Okay, or it's just the antibiotics that we have to take, or are there home remedies that we can use?
No, thank you very much. But that's why we thank God for the opportunity like this for advocacy. Because some of that will suffer is because of ignorance. That is why education is very key.
Yeah.
Lack of knowledge is a problem. That is why say those are river between my people are perished or destroyed for lack of knowledge. In Isaiah, what repeated, say my people are taken to captivity for lack of knowledge. So knowledge is very key. So what I'm trying to say is that there's no home remedy that you can take that will treat gonorrhea. But however, the antibiotics are already available in the market. The problem we're also having now is that because people are also abuse the antibiotics, they tend to be resistant. That is why anytime from now, guys, not that I'm trying to run an ad, but we'll be starting an STI clinic where people can come in, do their tests, just go. Then, especially for people who are at risk, then when they do their tests, they go home, they will call them back, if there's any infection, we treat. Because the rate at which gonorrhea is going on unnoticed, it's becoming an issue, and that is becoming a problem for us that take care of people who want to conceive. Not a problem to us. Somebody comes tomorrow now, the womb is completely damaged. I say, I've done like 5 IVSs, I'm not succeeding. What is happening? Well, the womb has been damaged. There's nothing to receive the baby in there. The endometrial line has been damaged by the woman had endometritis that was probably not treated when they were young. Okay, there was cervicitis that were not treated when they were young, and they end up having the endometrium gone. And when you put an embryo into that endometrium, it will definitely not work. So that I will not waste so much time. So let me go just run through to talk about the prevention, so that I know that I've finished talking for the day, that you cannot ask your questions.
All right.
But it's better to emphasize prevention. It's very key. Prevention, everybody says prevention is better than care. Prevention is better than cure. We have to normally say it again. Now, it's better. The safest way to avoid gonorrhea is to have abstinence.
Abstinence.
Okay.
So
if you can abstinence, fine. You can abstain, fine. But sometimes it's difficult to abstain by the virtue of the society we find ourselves. That's why I said earlier, I usually come out among the reproductive age group between 20 and 24 years. Because at this time, people are more daring, they engage in all forms of sexual intercourse. As at that time, because they are also very young, their ectocervix tend to be exposed easily. It's not well mature. And any trauma, then can acquire infection. So abstinence is the call. When they cannot abstain, so please we encourage them to use barrier method to prevent sexual intercourse. So we counsel them to use of condom is very key. Both male and female condoms are readily available, okay, and dental dam. So they are usually very available. So you can either use the condom, both either male or female, or you can use what we call the dental dam, which you normally put to prevent during kisses or during oral sex to avoid that you are not infected with gonorrhea. I will also say that it's also better, you have to know yourself, do not have sex with someone who has active infection. But someone that has discharge, someone that has discharge and go, there's no way. If you must have sex, don't try to avoid those kind of people. And if you must have sex with those kind of people, you must ensure that you use what we call condom. Do not have sex with someone who has gonorrhea symptoms. Some of them do have symptoms. It's the people who have symptoms. I understand even some men who engage in extramarital sex, they end up putting their innocent women in trouble. Likewise, too, female who also, it's not only me, who also engage in extramarital affair, end up putting their men into problem. So we counsel people, please, if you want to, that maybe you are pushed to the wall, you are becoming irresponsible enough to take care of yourself, try as much as possible. So even if you want to have sex, people that have any symptom like vaginal discharge, low abdominal pain, try to avoid sex with those kind of people. Don't get yourself involved with those kind of people.
Okay.
Then also, limit sexual partners. I don't understand why people have 1, 2, 3 girlfriends everywhere. I think it's unfair. I mean, at the risk of having that, limit sexual partners is very clean. Then openly discuss your sexual activity with your partner. Openly. That's why if your life is straight and you are sure what you are doing, you can put it. I have a girlfriend some time ago. You can discuss with your partner. It's very important. If your partner should also have understanding and understand the dynamics of it. But it's also very unfortunate that in this part of the world that you see a married man still having 2 or 3 concubines when they are not related to Solomon or related to one of the priests related to Solomon. So at the end of the day, you end up bringing those STIs home and you give to your innocent wife or you give to your innocent husband, and the thing becomes an issue. Now, if you have any symptoms, get tested. Try and go for tests. As I said, by the special grace of God, St. Ives will soon start running an STI clinic where patient can come. If you are worried about your testosterone, we'll take your swab. We'll take our swab from the rectum, from the vagina, we'll send for culture. And if we see organisms there, we'll quickly treat before it becomes an issue. Your partners, ensure that your partner get tested too. So if you also test, if you are also having symptoms, and you know that, you have symptoms, as you have done your own, ensure that your partner also come around and do it so that at the end of the day, everything. And now there are development of some what we call spermicide. Some of them are, but that one is not very effective, and they have been found to reduce the incidence of gonorrhea infection.
Oh, okay. Dr. Tazua, we have a call. Just a minute. Hello, good morning.
Good morning.
Good morning. What's your name? Where are you calling from?
My name is Esther from Mowi.
Esther from Mowi. How are you today, Esther?
I'm good.
All right.
Like, if gonorrhea is not properly treated.
If what?
Gonorrhea is not properly treated.
Yeah. What? What's
the effect?
Okay, if it's not properly treated.
Yes, ma'am. What's the effect?
Oh, what's the effect? All right, Esther, thank you very much for calling. All right, so Dr. Zazua, this is Esther calling from Moria, and she's asking if gonorrhea is not properly treated, what's the effect? And then we'll also have a message that says that he's also asking the same question. Please, what will happen to, but this one is for a man. What will happen to a man if gonorrhea is not properly treated?
Okay.
So Esther, yes, go ahead.
Do I answer, but I can just throw more light on it again.
Okay.
If it's not well treated, the issue is that there are a lot of complications that will arise, both male and female. Now, in female, sometimes if they can end up having, they cannot conceive again because if it's not well treated. Okay. Some of them too can end up having to transfer the infection to their partners again. They tell you some of them can have what we call pregnancy outside the womb, which is called ectopic pregnancy. Some of them can have chronic pelvic pain, which is called PID. Some of them can even have what we call intermenstrual bleeding. Some of them can have rectal bleeding. For the men can have urethral stricture. That means that they cannot be able to pass urine. They can have their testes damaged, and they will not be able to produce sperm again. Some of them can have what we call their testes swollen, and they may not be able to, and they will have pain if not well treated. Let me say here again, if you have gotten to that level of those damage, as I tell you, you can only reduce symptoms, you cannot reverse it. So that is why it's better to, if you notice any symptom of vagina, see your doctor who will now take sample and send for culture. So when the result now comes out and it's there, you cannot treat. Or some people can even say, this looks like, well, let me just treat antibiotics, but that causes a lot of abuse and everything. But however, it's not difficult to treat. That's why I say gonorrhea is not difficult to treat. But if it's not well treated, is an issue with it. So that's why we have to come, because most of the adolescents, or between the age of 20 to 25, those are the affirmative years, and when they get infected with gonorrhea, it becomes an issue later and become a problem to the innocent woman or to the innocent man who has lived life well with the expectation of becoming a father and mother. Now coming back to look for us again that, they've not been able to conceive. So those are issues. So it should be very clear.
Yes.
I would say that note that people who get prompt treatment and follow up instructions carefully can resume their normal lives after about 1 week. Whereas untreated gonorrhea can cause several long-term health problems. Gonorrhea can even be life-threatening without proper care. Gonorrhea can also be life-threatening without proper care. So that is why we ensure people. But however, some people, in order for you to protect, some people can ideally, every year, any woman that's within the reproductive age group can go for a gonorrhea testing, can do it once in a year, and if you notice anything, you treat. So it's not something that is difficult. So we encourage people to do do testing at least once in a year. So when they do that once in a year, there's less risk that they will acquire those that infection. So we encourage, that's what Center for Disease Control recommend, that every year I should have your test done for gonorrhea. So that is the major thing. Let me say here again that not to have sex cannot live long outside. Let me say that gonorrhea cannot live long outside the body. Most of the time, usually through sexual intercourse, through deep kisses and co, not by sitting on the toilet seat, or by hugging, or by sneezing, or by wearing clothes with infected people. So I will now say that who are those people that are at risk of having gonorrhea? Who are the people that are at risk of having gonorrhea? So we can just mention them. It's usually higher among adults between the age of 15 and 49 years old. Higher among vulnerable populations, poverty, vulnerable population. If you go to the rurals now, like the ghettos, I don't want to mention them. There's people of low socioeconomic group. They are at risk of having gonorrhea. Homosexuals who are at risk of having gonorrhea. Homosexuals that have sex with same partners, and they are at risk. People as commercial sex workers, they appear as some people commercial sex workers, they are at risk of having gonorrhea. People who also work for transgender women too. Transgender women who don't know whether they are male or female, also at risk of having gonorrhea. Adolescents between 12 and 20 years are at risk. Young people in high-burden countries are also at risk. Having sex with new partners that you don't even know anything about, you just know what God has blessed you, want to have sex, you want to do, like that people that doesn't have the wisdom to run like Joseph. They may probably, that's why may have gonorrhea, but Joseph ran away for his dear life. So they were having sex with new partners, they have a high risk of having gonorrhea. People who also have, who claim that they are very sharp, who discuss, believe, I have slept with this, I have slept with this, I have slept with this, they are also at risk of having gonorrhea, because at the end of the day, if you are sleeping with this, now you are dropping gonorrhea, you are collecting gonorrhea, collecting other form of sexually transmitted infections. So multiple sexual partners are at risk. If somebody has had gonorrhea before, also at risk of having gonorrhea. Okay? Use of people who use cocaine, who use eye drugs, on drugs, instead of sex drugs, for drugs and everything at risk of having gonorrhea. Even also early age, when somebody is exposed to sex, are also at risk of having gonorrhea. But I think that one is clear enough so that people that can easily acquire gonorrhea. So that is why we must be very careful and ensure we discuss our sexual life with our partners.
All right. Thank you so much, Dr. Sazua. So let's have your final words on this particular STI.
Okay. My final words is that I hope everybody has learned. That's number one. They have learned, and they have learned their lessons. Now can be very careful so that we can have a better country for us to live. So my candid advice and my sincere advice is that try to live well. When you live well, you also enjoy the quality of life, so that you are protected from this sexually transmitted disease, like this terrible one like gonorrhea. And if you live your life well and do the right thing, ensure that you go for your testing every year before you go for your testing, then you have less risk of acquiring gonorrhea.
Okay. All right. Thank you so much, Dr. Osazua,
But
for...
otherwise, I hope we have learned well today. So we'll still continue this our series. Maybe the next week we'll take another form of STI so that we can digest that. Maybe the next one we shall finish everything. We cannot finish because take like two part sections. But I think it's worth learning.
Yes.
And it's worth learning. So
Sure.
I won't say that we wasted our time. I hope everybody has learned well.
All right. Thank
Including
you.
me too.
All right. Including you, Dr. Osazua. Okay. All right. Thank you so much, Dr. Osazua, for coming on the program today and talking to us about gonorrhea. Thank you so much.
I appreciate it.
All right. Do have a great day and enjoy the rest of the week.
Thank you.
All right. Well, that's the much we can take today on this particular STI. Now, just like Dr. Osazua has said, we'll definitely continue looking at other STIs also. So I need you all to keep it a date with us next week, Tuesday, for Women's Health, right here on Women Radio, where we get to look at another aspect of women's health. All right, so this is Women Radio WFM 91.7, and the program we just finished listening to is Radio Doctor, that comes to you Mondays through Fridays, your free health consultation program where real doctors advise real people. And today's Women's Health on Radio Doctor is supported by ACT Foundation. So a very big thank you for tuning in and listening. And of course, those who called and sent in a message, we do appreciate all of your efforts to reach us today. Well, the network was not on our side today, but still appreciate all of you who took a time to keep trying until they got to us this morning. So, well, that's it for today on Radio Doctor. A very big thank you to the producer of the program, Esther Laribe, and the executive producer, Tom Okewale Shunaya. My name is Rose Yusuf Kaiser. Do have a lovely day ahead. Good morning.
WFM 91.7.